very happy to have with us next the CEO of Downstate Medical Center, Dr. David Berger, to take us from medication adherence to talking more about how hospitals are evaluating digital health solutions and what they're looking at when they do this. But first, David, great to see you. Thanks for joining us today. Tell the audience a little bit about your background.
So Stan, I am a surgeon by training, actually a surgical oncologist trained at MD Anderson in Houston. And I've been on a journey in terms of hospital administration for the last 20 years. I was the chief operating officer at Baylor St. Luke's in Houston. And now I am the CEO at Downstate. I have an extensive interest in digital health, having implemented numerous digital health solutions, as well as serving on the advisory board of numerous digital health startups.
That's incredible. And if you could, too, please give us an idea of what some of the things that Downstate is doing within this this situation. And we'll hand the virtual podium over to you while you walk through this a little bit.
Yeah, sure. So let me share my slides. And
yep, we can see them. They look good. Okay, yeah, addressing problems. There you go.
So I'm going to talk quickly about how I think about digital health solution and implementing it in the hospital. So the first thing is to make sure that the solution is addressing a major problem. And these are the 6 pivotal issues for the industry in 2023 as identified by PricewaterhouseCoopers. I actually combined 2 of these into what I believe is the most important issue, and that is how we solve clinical workforce shortages by using digital health. And then the second issue is obviously confronting affordability and disrupting costs coming out of the pandemic. But certainly the first thing is how we can apply digital health to solving some of the clinical workforce issues. So first thing, you need to address a major problem facing the hospital or the healthcare system. Secondly, I look at the team, and this is the UConn 2016 national champion women's basketball team. 4 straight national championships for Breanna Stewart, one of the greatest basketball players, women basketball players in history. But I want to know who's on the team of the digital health company. Specifically, what's their previous experience and who is the CEO and how are they engaged? But most importantly, I want to make sure that there's a clinical person on the team within the company, because having a clinical person is, I believe, is essential because they really understand how care is delivered within the institution. The other thing that I find that's very important, especially for a clinical solution, is fine if I'm the CEO and I like something, that's great, but I need to have a clinical champion within the institution that is also interested in the solution, because those are the people within the organization that have influence and credibility. Even though I'm a physician, I need a physician within my hospital who is interested in the solution, is engaged, and has capacity to work with the company in order to make sure that there's a successful implementation. The next thing is the solution needs to fit into the hospital's IT priorities. And there is a lot of things going on within the hospital in terms of IT priorities. A lot of us are moving to the cloud for enhanced cybersecurity. We are very involved in terms of working with our EHR and trying to implement our electronic health records. Then there's the back office side in terms of revenue cycle, trying to apply AI to enhance coding and billing. So the solution really needs to fit in the priorities, and there needs to be capacity within the IT infrastructure within the hospital itself. Next thing is really, and this is one of the most critical, is what is the company's implementation plan? How much of the implementation is being taken on by the company itself, and how much is being put on the institution? And my preference is to make sure that we have an implementation plan that is predominantly the responsibility of the company that we're engaged with, and there is a minimal amount of responsibility upon my people and my IT systems. And the other thing with implementation is, does this decrease the work of the end user? So I'll give you an example of a poor implementation in an institution I worked at previously, where the bulk of it was a bed board solution, meaning they were tracking patient movement throughout the hospital, and especially looking at the issue of patient discharge. In order to get the trigger on the bed board, the nurse who was discharging the patient had to trigger the solution. And what we found was that was not happening. And the reason that was not happening was because when a nurse triggers the bed board to say there's a discharge, they get a new patient. So essentially, you're creating more work for that particular nurse. So you really have to think about your implementation, who within the institution is responsible for triggering the various events, and are you actually decreasing the work of the people that it's intended to help? And then most importantly is, what is your business model? So you heard from Recovery Plus this morning, and that is a company that we are currently actively looking at. And one of the reasons that I'm excited about Recovery Plus is because there is a CPT code associated with what they're trying to do, meaning they can actually bill for the service, meaning, again, there's no charge to the hospital for implementing the solution. So if there's going to be a cost to the hospital, and most of these digital solutions, it's a SaaS model, it's a cost to the hospital, it becomes very, very difficult to justify. The easiest way to get a CEO's attention is if you can link your service to a code, a billing code, and get reimbursement directly. The second most important business model that I tend to like is one where you're enhancing our revenue. So the solution is being put in place, and somehow it provides us with either passive or minimally active a revenue source. The most difficult ones to justify are the ones that are going to save us money. And certainly when I look at something that's going to save us money, I want the company to take risk on that. And also I'm looking for at least an ROI 3 to 4 times. So in conclusion, that's the quick way I look at a digital health solution, and happy to entertain any questions that may come up on the chat, but that is what I wanted to say this afternoon.
It's a really great analysis, and obviously all the good work that Downstate's doing. You guys are in the thick of it. You're a safety net hospital. You're seeing you're the cornerstone hospital for Brooklyn, and so these decisions are really important. Every single decision you make is going to either alleviate strain or put strain on one of your units, one of your departments, one of your divisions. And so you have to take every single one of these things very seriously and make sure that the evaluations are bulletproof as you're doing them.
Yeah,
And again, we've got a few minutes left. Would love to know more about the digital health technologies that you're seeing that seem to be most promising, either ones that you've recently implemented or ones that you are looking to implement. If there's a category, whether it's more along the lines of an app or a digital therapeutic or a healthcare delivery service like a Recovery Plus, what types of digital health solutions are you seeing coming in and really making a difference and improving and optimizing your revenues and things like that?
So first, I wanted to just give a plug to Breakthrough One, and thank you, Stan, for bringing companies to us that potentially can help us either operationally or financially. So things I'm looking at right now, and like I mentioned, I really like Recovery Plus because it's really passive revenue coming to our physicians. So that's one thing, but we are looking at revenue cycle solutions. The other thing, we are doing a study to look at what our nurses are actually doing and how much of that is nurse work, and trying to identify solutions that may enhance what our nurses are able to do during the day and alleviate their work. We're very interested in looking at the EHR, how we can improve the EHR experience, how we can use AI and natural language processing to help our physicians more easily document what they need to do. And then the other thing that we're very interested in is dealing with social determinants of health. So how do you collect the data on social determinants of health? And then more importantly, how do you connect patients to community-based organizations that can help with the social determinants of health issues that our patients are dealing with? So those are some of the main things that we're currently looking at.
That makes a ton of sense. That makes a lot of sense. And that wraps up our time. I know it's 1 o'clock. You have a hard stop at 1. Thank you again for joining us today, Dr. Berger. I really appreciate it. And a huge round of applause from the audience around the world watching this and learning more about what safety net hospitals in America are really trying to manage today. So thank you for that.
Thank you, Stan.